We're excited to announce that our podcast, The Table with Renee Da Silva, is evolving. We're introducing 3 new streams of content on this podcast, designed for Health System CXOs and hosted by the Health Management Academy's subject matter experts for health system nurse executives, health equity officers, and strategy executives. With this change, we'll be activating health system leaders towards outcomes and scalable solutions you can implement now.
Welcome to the Health System CXO podcast, featuring 3 streams of content designed for health system nurse executives, health equity officers, and strategy executives. My name is Ann Herleth, VP of Member Insights at the Health Management Academy, and your Nurse Executives host, discussing the issues that matter most to nurse executives, their leadership teams, and systems, and inspiring innovation across the practice and care continuum. Understanding the perspective of the frontline nurse is more important than ever. As nurse and other executives look to solve workforce challenges and transform care delivery, how well you understand the perceptions and the perspectives and the motivators of the frontline could make or break you. And so today, I'm excited to introduce part 1 of a 3-part series on the frontline nurse. Specifically, we're going to be unpacking how the frontline thinks about a range of topics, including AI, virtual nursing, safe staffing, and mandated ratios. And then in part 3, we'll dive into where nurses look for trusted information, both inside and outside their organization. Across this 3-part series, I'm going to refer to data and insights stemming from a frontline RN research study that my team, Nursing Catalyst, conducted across the summer of 2024. The research includes data from a survey of over 400 acute care nurses, as well as insights from our message testing and focus groups with frontline RNs and frontline nurse managers. If you're interested in more information about these data, if you're someone who really likes to dig into the details, I'd refer you to the show notes. We have more information about how to get in touch with us and where you can learn more. So today, for part 1 of this 3-part series, I want to talk about AI in healthcare. And I want to set the record straight by diving into our newest data directly and listening to what frontline nurses are actually saying about AI. Hopefully, it's going to give you a fresh perspective on what nurses really think. And spoiler alert, it's not what you might expect. So let's start with the big myth. Nurses are universally opposed to AI in healthcare. If you've been following the news, you might think this is true. And I think this stems back to the Kaiser nurse protests when they were holding up signs that said, "Trust nurses, not AI." That felt like the beginning of what has been an onslaught of headlines and other outlets parroting this sentiment. A sentiment that, at least based on our data, is not true. In our work, we found that a majority of nurses aren't opposed to AI. If anything, they're ambivalent. When we looked at the data, only 14% of nurses said they strongly oppose AI in their workflows in healthcare. On the flip side, only 8% strongly support. So what that means is we have a vast majority, nearly 78%, that falls somewhere in the middle. They're neutral or they're slightly leaning one direction or the other. And this is similar to what other research groups are finding. Just this week, I read a headline in Becker's Health IT that said, "Top 8 ways to ease nurses' AI fears." But when I dug into the McKinsey report that backed up this headline, it found that the majority of nurses want AI tools to support their work. This isn't a workforce that is adamantly against AI. It's a workforce that's cautious, maybe a little uncertain, but open to change and ways to make their job easier, better, and potentially more joyful again. And that's a whole different ballgame than what the headlines and, let's call them, other outlets are telling us. So it gets really interesting when you dig a little deeper and you look at the different types of use cases then that nurses are particularly receptive to. And I think the most popular AI application among nurses won't shock any of us, and that's automated documentation. The voice to text, the ambient listening that will be able to save nurses hours and hours of documenting in the EMR. Right behind that then is AI for translating care plans to patient-friendly language. So things that are going to allow nurses to step away from the computer and spend more time at the bedside. What's least popular with nurses then? AI-powered scheduling. Nurses really want to maintain control over their own schedules and the way things are done. and I don't think that will surprise any of us. This really tells us something crucial when it comes to nurses and AI. Nurses are open to AI that helps them do their job better and allows them to spend more time with patients. They're less keen on AI that tries to make decisions for them or makes changes in their core workflows. Now, I don't want to totally dismiss some of the concerns out there that the Frontline has with AI, because frontline nurses are rightfully cautious of some of the changes to care delivery. When we asked them about their top concerns, a whopping 73% of nurses said the impact on patient care quality and experience was number one. They are worried about things like the accuracy of AI-generated content and whether AI can pick up on those subtle human cues that so many nurses rely on. In some of our focus groups, nurses said things like AI lacks the ability to see the full picture of patient care, and it doesn't have the gut feeling that only humans and really so many nurses talk about having. The second biggest concern was really around data integrity and reliability. Almost 60% of nurses worry about this. And they're not just concerned about AI making mistakes, but the big concern here that came out, particularly in our focus groups, is who takes the blame when something goes wrong. As one nurse said to us, it's always the nurse's fault in the end. One interesting thing I will call out here, because it flies directly against some of the headlines that I have seen in popular media, is that job security isn't a top concern. It's not a concern, because 55% of nurses did say, hey, I am worried that AI could impact my job security, but it's not the primary issue that they are concerned about. At the end of the day, nurses are really thinking about how will AI impact the patients and how will it impact my job and how I get work done. Now, here's the really interesting part of the work that we did. I mentioned at the beginning that the data I'm talking about today comes from a survey, but we also did message testing as part of that survey. For those who are less familiar with message testing, it is a market research method that evaluates how messages, whether it's a commercial advertising or data points, resonate with its target audience. It's a way to assess the effectiveness of a message before it's released to that wider audience and how, if at all, a message can sway behaviors, thoughts, or feelings. It's very common in marketing, and that's exactly where your brain went when I said message testing, but it's helpful to understand that you can do message testing in other settings, and that is what we did to help understand if we can change frontline perceptions around AI. The great news here is you can. In fact, you can change perceptions of AI by simply sharing the right type of data with RNs. For example, before we presented facts about AI in healthcare, only 28% of nurses supported its implementation. But after we gave them relevant data points, that jumped to 51%. That is a massive shift, and a massive shift that came from just a couple of data points. It tells us that nurses' hesitation about AI isn't set in stone, and that it's based more on a lack of information rather than a disinterest in using it. When nurses are given concrete, evidence-based information about AI's impact, many of them become much more supportive. To capitalize on this opportunity, I recommend that healthcare leaders focus on leading with concrete outcomes data from pilot testing and create platforms for peer-to-peer knowledge sharing. By following this approach, leaders can build a foundation of trust and understanding that is crucial for the integration of AI into nursing practice. So what's the takeaway here? I shared a lot of information. I tried to bust some myths. So let me give you 3 things I hope you take away from this 10 minutes or so. First, we need to stop perpetuating the myth that nurses are universally opposed to AI. It is not true, and it's doing a disservice to the nursing profession. Second, we need to listen to nurses' actual concerns, not the hyped headlines or the loud voices. They're not worried about job security as much as they are about patient care and data reliability. And finally, executives need to do a better job of communicating with nurses about AI, because when given good information, many become much more supportive of AI, and that is a huge opportunity. The future of healthcare isn't going to be human versus AI. It's going to be humans and AI working together. And nurses, as always, will be on the front lines of this. So let's make sure we're listening to what they actually have to say. Thanks for tuning in. I hope you'll join me for part 2 of this discussion on frontline nurses, where we'll focus on perceptions around safe staffing, mandated ratios, and the implications for the profession. Until then, keep innovating. Thank you for joining me on the Health System CXO podcast, where we activate health system leaders towards outcomes and scalable solutions that you can implement now. Remember to subscribe to the Health System CXO podcast on your favorite podcast platform so you never miss an opportunity to hear more. And if you liked the episode, consider leaving us a review and sharing our podcast with your colleagues. You can also connect with us on LinkedIn by clicking the link in the episode description. See you next time.